Today I'm presenting some of the findings of a national survey which was initiated by Marie Curie and facilitated by the James Linden Alliance. And it was called the Palliative and End-of-Life Care Priority Research Partnership, which looked at what are the burning questions from the point of the users of a service and users and providers, meaning healthcare professionals, patients and current carers and bereaved carers. This survey was conducted with the aim to identify questions that they need to be answered by research, and they are related to patients, families and healthcare providers' needs. The work I talked today was focused on a specific theme coming from this survey, which was the financial burden of informal caregiving. We found out that palliative care, especially when it is provided in communities or at home, is having significant financial implications for families because they are intensively caregiving for those patients. And the costs are related to either out-of-pocket money or services they resourced for their loved one, or taking time off work so that they look after the patient. In terms of patient financial costs, all of the discussion was around those services and equipment and facilities that are required so that the patient can have quality of life and quality of care by remaining at home or in the community. And what we found is that people find it that there is lack of resources. The existing resources are very scattered, and there is a need for coordination of those resources. And whatever it is out there is not actually transferred to the carers or the patients, and therefore, even if it is out there, people cannot access it. And this is very important because we know that there's a current trend in demographics of a place of death and care, where more patients now die at home or in the community, and that means more family members will have to provide for them. And therefore, the caregiving will not go away. It's going to get even more intensified. What the participants of this survey requested from us was to acknowledge the issue, to provide financial support for both the patients and the carers. They specifically asked for employment benefit or time off from work so that they can provide for their loved ones. They also asked financial support before and after death, funeral costs, bereavement support, allowances. And they also asked a key point of contact where they can be assessed, get the information they need, and receive what they need. The fact that whatever is out there is given by different schemes, social care, healthcare, makes it almost impossible for families at that crucial point of end of life to access whatever is out there for them. And also, by the time they manage to figure out the system, it's too late for them because the patients have deteriorated. So the fact that we don't do that in a timely manner has significant implication for the family and the patient because they can't receive it on time. Well, there's now a new initiative, a government initiative, to integrate health and social care. And this is something we would very much support because it's very difficult to decide which resources should be allocated to which pathway. And then when you have different streams, there's always this debate and sometimes the frustration of who is paying what. We could actually avoid that and coordinate services much better if those services were integrated. And that would mean that the patient or the family would have one point of contact where they could go and receive the support they need. But for research also, it's very important to acknowledge the issue of financial burden for informal caregiving for two reasons. One is that it's going to get more intensified because people die more now at home. Secondly, because the new policy initiatives suggest that we should withhold unnecessary treatments or unnecessary hospitalizations and keep people at home. That means then again that the family will have to do that. But what we don't know and we need to explore further is these financial burdens, what a kind of impact they have in families. There is little evidence suggesting that the financial constraints at this point in life for the family means increased anxiety, increased depression, increased difficulties in coping, serious decisions like changing homes or leaving work. And we haven't explored that much into depth. We need to understand that because we need families on board. Because if we don't support the families will not support the patient to die at home. And we do know that patients' preferences are to be looked after at home and die at home. We also know that family carers have lower preferences in place of care and death at home, probably because of the struggles they have to manage to support the patient at home. And we also know there was the quality study from King's by Gomez and her team. They found out that in a survey of 600 bereaved carers, they found that if the family members are not supporting for the patient to be looked after at home and die at home at the end of life, it's very likely that the patient's wishes will not be met, will not be fulfilled. The carer's wish will be overpower that. And we also know, they also found that family members who had managed to secure time off work or financial support around that in order to be out of work within the last 3 months of patient's life, they were more likely to support the patient to be looked after at home and die at home. So it is very crucial that we actually find a way. We acknowledge that families probably partially fund palliative care at home, that they need support in order to provide the care for their loved ones. And if we want to secure the fulfillment of the patient's wishes, we need to support their families. I'll answer you back. What if we don't do anything from now on? Imagine if we choose to ignore that families are actually taking significant part in the caregiving, and they actually pay for significant part of palliative care in the community, and yet we choose to ignore that. Imagine what is going to happen for those who can't afford to pay for themselves. Imagine what is going to happen for those communities that they are deprived. Imagine what is going to happen to those most vulnerable who don't have access to financial resources. Also, imagine if we choose to ignore that the financial constraints of end-of-life care, especially in community and at home, have a significant impact, negative impact, on the well-being of the family members during caregiving and after death in bereavement stage. Most of us, at some point in our life, we will be either caregivers or bereaved caregivers. Imagine if we don't do anything about that.